disease doesn't happen overnight, but the damage does. If you've ever woken up feeling exhausted, struggled with random heart palpitations, or felt your chest tighten after a stressful day, it's not just in your head. Your heart is under pressure, and what you do at night plays a bigger role than you think. But here's the good news. By the end of this video, you'll know exactly what's causing it, and more importantly, how to fix it before it's too late. We won't waste your time. Let's jump straight into the problem. The truth is, your heart never truly rests. Even while you sleep, it's working hard to keep you alive. But what if I told you that a simple habit, something most people do without thinking, could be making your heart work overtime in the worst way possible? Studies have shown that certain nighttime behaviors can spike your cortisol levels, increase blood pressure, and put unnecessary strain on your cardiovascular system. And over time, this stress can lead to heart disease, strokes, and even sudden cardiac events. The scariest part? You won't feel the effects immediately. There are no warning signs, no alarms, just silent damage happening night after night. But here's the thing. We're not here to take away the small joys in life. We'll point out exactly what's harming your heart, show you how to fix it, and give you solutions that let you stay healthy without giving up the things you love. No extreme diets, no impossible lifestyle changes, just simple, science-backed adjustments that could literally add years to your life. So what exactly are these habits, and why are they so dangerous? Let's break them down. The habit we're talking about is something almost everyone does, using screens late at night. Whether it's scrolling through your phone, binge-watching a show, or answering one last email, this simple act is quietly putting immense strain on your heart. At first, it doesn't seem like a big deal. Maybe you're just checking a few things before bed, watching TV, or reading on a tablet. But those few minutes turn into an hour, or more. And while you might think you're just unwinding, your body is experiencing something completely different. Here's why this matters. Your heart isn't just a pump. It's part of a finely tuned system that runs on a daily cycle. Your blood pressure, heart rate, and even the way your blood vessels expand and contract all follow a schedule based on when you wake up and when you go to sleep. This is why doctors often see heart attacks happening more in the morning, because your body naturally increases blood pressure to prepare for the day. At night, the opposite should happen. Your body is supposed to slow down, lower your blood pressure, and allow your heart to recover from all the work it did during the day. But if you're exposing yourself to bright screens, your brain gets confused. It thinks it's still daytime, which stops your body from winding down properly. The biggest issue here isn't just losing sleep. When your brain perceives light at night, it doesn't just delay sleep, it triggers stress. Stress increases your heart rate and keeps your blood vessels tight, which means your heart has to push harder to circulate blood. Do this night after night, and that extra strain starts to wear your heart down. One study even found that people who regularly expose themselves to bright lights before bed are more likely to develop high blood pressure and heart-related issues, regardless of their age or overall health. Your heart needs time to rest, just like every other part of your body, and late-night screen use is keeping it in a constant state of overwork. But screens aren't the only thing silently harming your heart at night. In fact, there are two more common nighttime habits that most people don't think twice about, both of which have been linked to serious heart issues. Let's get into the next one. The second habit that could be damaging your heart at night is eating after 8 p.m. A lot of people don't think twice about having a late dinner or a snack before bed. Maybe you got home late, maybe you weren't hungry earlier, or maybe it's just part of your routine. Watching TV with a bowl of something on your lap. It seems harmless, but eating too close to bedtime puts unnecessary strain on your heart in ways most people never consider. Here's why this matters. Your body follows a natural rhythm throughout the day. Your heart, your digestion, your metabolism. They all have specific times when they work harder and times when they slow down to recover. At night, your body is supposed to shift into repair mode. Your heart rate should drop, your blood pressure should decrease, and your system should focus on recovery. But when you eat late, especially after 8 p.m, you interrupt this process. Your body has to redirect energy to digest that food instead of resting. And digestion isn't a small task. Your stomach has to break down food, your intestines have to absorb nutrients, and your pancreas has to release insulin to manage blood sugar levels. All of this requires your heart to keep pumping at a higher rate, instead of slowing down like it's supposed to. One study found that people who regularly eat within 2 hours of bedtime have a significantly higher risk of developing high blood pressure. Why? Because late-night eating keeps your stress hormones active, and stress hormones naturally increase blood pressure. Over time, this constant elevation puts extra strain on your heart and arteries, leading to long-term cardiovascular problems. And it's not just about your heart rate. Late-night eating also affects your blood sugar levels. Your body processes food more efficiently during the day when you're active. But at night, your metabolism slows down. This means that instead of using that food for energy, your body is more likely to store it as fat, especially around the abdomen. And here's the problem. Excess belly fat isn't just about weight gain. It's directly linked to an increased risk of heart disease because it releases inflammatory chemicals that damage your arteries over time. Another thing to consider is acid reflux. If you eat late and then lie down soon after, stomach acid can flow back up into your esophagus, causing heartburn. And while heartburn itself might just feel like discomfort, chronic acid reflux can cause long-term inflammation in your body, which has been linked to higher risks of heart disease. So what should you do? The best approach is to make sure your last full meal is at least 3 hours before bedtime. This gives your body enough time to digest properly before you sleep. If you do get hungry late at night, it's important to choose the right kind of snack, but we'll talk about that in another video. But before we wrap up, there's one more nighttime habit that could be quietly damaging your heart. And this one is something people don't even realize they're doing. The third nighttime habit that could be harming your heart is sleeping on your back, especially if you snore or have sleep apnea. Most people don't realize this, but the position you sleep in can have a direct impact on your heart. And the worst position for heart health? Sleeping on your back. Here's why. When you sleep on your back, gravity causes your tongue and soft tissues in your throat to collapse backward. This partially blocks your airway, making it harder for you to breathe. If you snore, it means air is struggling to get through. And if you have sleep apnea, even mild sleep apnea, your breathing actually stops multiple times throughout the night. Every time this happens, your oxygen levels drop. Your brain signals your body to wake up just enough to restart breathing, and your heart rate spikes. This constant cycle puts tremendous strain on your cardiovascular system. Your heart is forced to work harder, your blood pressure increases, and over time, this greatly raises your risk of heart disease, arrhythmias, and even heart failure. Studies have shown that people with untreated sleep apnea are 2 to 4 times more likely to develop serious heart conditions. And here's something even more concerning. Many people don't even know they have sleep apnea. If you wake up feeling tired, experience frequent headaches in the morning, or if your partner notices that you snore loudly or gasp for air in your sleep, you may have it without realizing it. The problem isn't just the poor sleep quality, it's the ongoing damage to your heart that happens every single night. So, what's the best way to sleep for heart health? Research shows that sleeping on your left side is the best option. This position helps improve circulation, reduces pressure on your heart, and makes it easier for your body to pump blood efficiently. It also helps with digestion and reduces acid reflux, another hidden cause of nighttime heart strain. If you've been sleeping on your back for years, switching to your side might feel uncomfortable at first, but it's worth the adjustment. You can use a body pillow to keep yourself in place or place a pillow behind your back to prevent rolling over during the night. And if you suspect you have sleep apnea, it's important to get tested. There are treatments that can drastically improve your sleep and protect your heart in the long run. Now, let's quickly recap. The 3 biggest nighttime habits that could be damaging your heart are using screens before bed, eating after 8 p.m., and sleeping on your back. Each of these habits forces your heart to work harder than it should at a time when it's supposed to be resting and recovering. And over time, that extra strain can lead to serious problems. But here's the good news. You don't have to make huge changes overnight. Start with one. If you usually eat late, try finishing dinner earlier. If you're guilty of scrolling on your phone before bed, switch to a book instead. If you sleep on your back, start training yourself to sleep on your side. Even small adjustments can have a huge impact on your heart health in the long run. Your heart never takes a break. While you sleep, it's still working, pumping blood, delivering oxygen, and keeping you alive. But the choices you make at night can either help your heart recover or force it to work overtime, increasing the risk of serious health problems down the road. We've talked about 3 major nighttime habits that put unnecessary strain on your heart: using screens before bed, eating after 8 p.m., and sleeping on your back. Each of these habits disrupts your body's natural rhythm, making it harder for your heart to do its job efficiently. But here's the most important thing to remember: these problems are completely avoidable. Making small, intentional changes to your nighttime routine can significantly lower your risk of high blood pressure, heart disease, and other cardiovascular issues. And the best part? You don't have to give up the things you enjoy. You just need to be smarter about when and how you do them. If this video gave you even one useful tip, do me a favor. Hit that like button. It's a small action, but it helps more people see this video so they can start protecting their heart too. And if you know someone, maybe a family member or a friend, who stays up late scrolling, eats late at night, or has trouble sleeping, share this video with them. You might just help them avoid serious heart problems in the future. For more tips on keeping your heart strong and living a healthier life, make sure to subscribe and turn on notifications. We've got plenty more videos coming your way, and you won't want to miss them. Take care of your heart, and I'll see you in the next one.